So David, we're both hypnotherapists. Would you like to say why hypnotherapy is such a great tool?
Yeah, there's many talking therapies out there and they do a very good job. But they only access about 10% of the human brain, and that's the conscious part of the brain. In hypnotherapy, we're interested in accessing the subconscious part of the brain, that bit behind the locked door that you can't access under normal conscious awareness. And by taking somebody into hypnosis and carrying out therapy, which is known as hypnotherapy, while someone is in hypnosis, we can then access those hidden folders and explain why people have certain behaviours, certain traits in the present day. And it all has to do with stuff that they learn from a very, very young age.
It always seems to be when they were children, doesn't it? Going way back that people's problems started. That always seems to be the root.
Yeah, in virtually every case, it's learned behaviour. From just before birth until around the age of 6 years old, where all this data that you see, feel, hear and smell, it just gets dumped unsorted into the subconscious brain. You know, when children are born, they're pretty much perfect. We only have two phobias when we're born. We have a fear of being dropped and we have a fear of loud noises. But these phobias only last a few weeks. And then we're starting with a clean sheet, as it were. And then mums and dads come along, and sometimes with all good intentions, they teach us to be scared of certain things, certain situations. But we are born pretty much perfect. And we start off with an empty toolbox, and we have to learn what is safe, what is dangerous, what should we touch, what should we not touch, what situations should we not allow ourselves to get into. And it's us struggling for all this information when we're very young that causes us to take on the majority of good stuff, but also some perhaps stuff that could lead to phobias in as an adult. For example, a fear of spiders.
Yes.
You imagine a 1-year-old sitting in this chair here, a spider walks across the table, they've never seen one, there is zero fear. Until they go to grab it and mummy walks into the kitchen and screams, at which point a folder is created in their subconscious saying, that's called a spider, they're very dangerous, mummy screamed and slapped my hand or whatever, never go near one again. So from that moment onwards, that child then has a fear of those things called spiders. Absolutely.
And sometimes these phobias can be caused by something that's actually got nothing to do with what they think they're frightened of.
Very much so. I mean, I had a lady this week who thought she had a fear of spiders. She did have a fear of spiders, but she had a fear of embarrassment as well.
Yes.
And she remembered while she was in hypnosis standing in the school playground, and she was, I don't know, maybe 5 years old, and the girls were skipping. And a spider ran across the playground floor, and one of the other girls started screaming, at which point all the other girls pointed at her and started laughing. And this girl was really, really embarrassed. So a folder was created in her subconscious, basically saying, if one of those things runs across the floor and you scream, everybody laughs and points at you. And this was all revealed while she was in hypnosis, and she became quite emotional, feeling those feelings of embarrassment, having everybody point at this particular girl. So yes, she had a fear of spiders, but it wasn't as straightforward as that. She had a fear of a spider coming along and then for her to do something that would embarrass herself.
And what always amazes me is how many different things can be fixed at the same time. It seems to have like a knock-on effect, hypnotherapy, I find.
Very much so. I have a technique, and I'm sure you use a similar technique, where we don't deal with present-day symptoms. The lady that was sitting in that chair an hour ago, she is a nurse in an emergency operating theatre, and she deals with trauma cases. And she came to see me because she had a fear of failure. Every time a surgeon asked her to do something, to perform a task, she became very, very fearful. And she had a fear of making a mistake. So instead of treating a fear of failure, I just sat her in the chair and I said to her subconscious, let's talk about the problem. Now the very first words that popped into her mind was water. Fear of water. And as we got into the session, she remembered a scene when she was 3 years old and she was on the beach with her brothers and her cousins. And she walked towards the water's edge, at which point her auntie, who was looking after her, said, no, 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 you can't swim, you're going to drown, you're not like the others. At which point a folder was created in her subconscious, you're not like the others, you're not going to be able to swim. And then she remembered another scene where she was standing at the top of the stairs as a young child, and her mum shouted out, you're going to fall. So all these seeds are being planted in this young girl's mind. So when, as in the present day, and apparently she gets glowing reviews about her performance, but she doesn't see that. She's terrified of putting herself into a situation where she's going to make a mistake. And she's dealing with human lives.
Yes.
So
Yes.
In answer to your question, no, it's never a specific thing. It covers, and that's the beauty of hypnosis. Instead of talking about, so tell me when you developed your fear of failure, as hypnotherapists we talk about it or the problem.
Well, that's it. And I was just going to say as well, I mean, a lot of people have psychotherapy to get to the root of what it is, which can go on for a very long time. And to me, one of the beauties of hypnotherapy is that it's quick.
Yeah, but quite often I've had patients that have come to see me who've had psychotherapy and thought that they'd got to the root.
Yes,
and it was something when I was 10 years old, and I say to them, perhaps it isn't the thing that happened when you were 10. And as soon as they're in hypnosis, they're 3 years old, and something, perhaps nothing to do with the particular issue, crops up whilst they're in hypnosis. And then that is the final piece of the jigsaw.
Absolutely, absolutely. And I wonder why, you know, I can kind of understand why a lot of people feel quite scared about hypnosis, because they think that they're going to have this thing done to them and you're going to control them and things. And sometimes I have to spend quite a bit of time explaining the whole process to them so that they're quite confident.
Yeah, I mean, I agree with you. The very first session I spend in getting people's faith in the therapy, explaining what hypnosis is. And I think it's absolutely crucial that you allow people to understand they are not out of control. They see stuff on TV where they think they're powerless and we're going to make them do things that they don't want to do. So it's crucial. And I'm a great believer, as I know you are, in self-hypnosis, where we teach them how to hypnotize themselves, just to illustrate that they can come out of hypnosis whenever they want. So I think that is absolutely crucial.
Yes, and plus which people are in and out of hypnosis all the time anyway, aren't they? I think, didn't you say there was a professor on television who'd been talking about that?
Last year this professor said that we are in hypnosis 24/7, but just at differing depths. But throughout the course of 24 hours, we are like driving a car.
Exactly.
I mean, we don't concentrate. We think we're concentrating when we're driving a car, but we're not. Our conscious brain is saying, oh, I've got to phone up John, I've got to go to this meeting, and then I've got to phone this patient. That's what our conscious brains are saying. But our subconscious brains are saying, red traffic light, child with football, man on a bicycle. So that's a form of hypnosis. You know, people say, what does hypnosis feel like to me? And I'm sure they say the same to you. Well, it's driving a car, it's riding a bicycle, it's, you know, reading a book and getting totally engrossed in a book.
Absolutely. And yet it's this kind of, it is this heightened state of awareness being in hypnosis, because people are so, I think one of the fears is that they're not going to really know what's going on around them, that they're going to have no memory of what's happened.
Which, as we know, is exactly the opposite.
Absolutely.
You know, when people are in an HSA, a heightened state of awareness, they are 2,000% more aware what is going on around them than under normal consciousness. And once again, this is something that we have to explain to our people. You know, if you're not going to be in a coma, you're not going to be unconscious, you're not going to be under general anaesthetic, you are going to be wide awake, yet your eyes are going to be closed, and you're going to be totally chilled out. And the way I explain it to people is that when a blind man is about to cross the road, his ears are so sensitive, his hearing is heightened, and the reason it's heightened is to protect him, is to keep him safe. You know, before any of my people go into hypnosis, I say to them, you are going to hear cars going past, you are going to hear someone maybe bang the toilet door outside, or there's going to be a loud motorcycle going past. All of these sounds are going to be really loud, but I want them to be loud. Because what it's saying to their subconscious whilst they're sitting there in that chair in hypnosis is, you're safe, you're fine.
Exactly.
If this room was soundproof, they would be sitting there thinking, I'm not happy with this, I can't get my bearings. And I'm sure you find that the people perhaps who've had hypnosis before say, well, I was aware the whole time.
Oh, all the time, yes.
But if it had been explained to them,
yes, then they wouldn't have worried.
Then they wouldn't have worried about it.
Exactly.